Now, whether it's because of cost or just frankly out of fear, one area that is often neglected is dental health. In fact, we're seeing more people going to the hospital because of dental health issues, things that honestly could have been prevented. Now, we saw about 1 million ER visits because of this back in the year 2000. That number shot up to about 2 million by 2010. Kamasi Aaron taking a look at solutions to this growing problem.
Elvia Lopez may be one of the few people who somewhat enjoys going to the dentist, and for good reason.
The people who work here, they really pay attention to you and it helps you feel good.
But that's not the only reason.
I feel comfortable with the prices.
Elvia pays for treatment based on her income. Today, it's a cleaning, but she might not be here getting it without the sliding scale.
There's effort put into it, but sometimes you can't do it.
She's at the dental clinic at the Inner City Health Center. Dentists here see patients for emergencies, cleanings, crowns, and everything in between. This clinic averages about 600 patient visits every month, and it doesn't matter if you have insurance or not. This is one of the places people are referred to after dental pain lands them in the hospital.
Sometimes we'll have patients who come in saying they went to the ER over the weekend because they had a huge abscess, a huge infection, and basically the hospital will just send them home with antibiotics and tell them to go to a dentist.
Dental director Dr. Andrea Leung says that's common because hospitals aren't equipped to provide comprehensive dental care. That's why hospitals around the country are collaborating with dentist offices that can provide appropriate and effective treatment for much less than what they offer.
We will see anyone who walks through the door. We don't really ask them questions. It's basically if they need dental care, then our door is open to them.
Emergencies here are a $60 flat fee, and patients pay for other treatments based on income. Working to keep dental issues at the dentist's office with accessibility for all. For The Race, I'm Kamasi Aaron.
Now, right now here on The Race, we're going to take you to two very different cities with two very different titles when it comes to community health. Nicole Val talking to leaders about what they're doing to improve access to health and health care in the Motor City.
It's the country's comeback capital, known for its Motown classics, American cars, and with staggering stats of smokers, disease, and obesity, it's also one of the most unhealthy cities in America.
I mean, I'm not gonna say it's not true to an extent.
Mike McCool is the co-founder of Slow Roll Detroit.
We wanted a weekly night where we all got together and rode bikes and just cruised around.
An idea sparked 7 years ago with only a few people, but that quickly changed.
It just blew up.
Now there's about 5,000 to 6,000 riders each and every week, spring, summer, and fall.
There you go.
The mission is to bring people together and promote healthy activity.
Intentionally made it a slow moving ride so that it would be open and available to anybody of any level.
But the truth is,
well, after you're done, you stampede to the nearest watering hole and get a burger and beer.
Outside of this effort, we wanted to know what local leaders are doing to move community health to the top of the list.
We're knocking on doors. We're asking people what their needs are.
Dr. Jonay Khaldoon, the city's health director, says through neighborhood programs and education, they're starting to create more health and health care options for residents.
Right now we're looking at where are those gaps, what are those challenges.
New services like health hotlines and bike share stations are being put in place. A priority, Khaldoon says, especially for an area where income levels are low.
Unfortunately, when you're living in poverty, it's even harder to meet those basic needs, and so we're all working together to make sure Detroiters can be as healthy as possible.
When it comes to the real champions for change,
the community is really one of the greatest assets in Detroit.
Many here say all you have to do is look to the people.
Fight life, baby.
Healthy changes may come at a slower pace here, but those who call this home know anything is possible.
So I wouldn't say we're an unhealthy city. We're just working on it.
For The Race, I'm Nicole Vowell reporting.
Coming up next on The Race, she's making a move across the map to a city in New England known for its healthy people, how that college town is staying fit, and the challenges it faces. Next.